Thanks, Allison. As usual, you're just so awesome at helping facilitate these webinars that I do every month. And also wanted to say that when you get the recording, you also get the slide deck, so you can kind of sit back and relax and enjoy and not have to furiously take notes. And also, we have a lot of people on demand, so hello to you. This is a very important topic today. I don't need to tell you how much anxiety has increased in our children. Um, and I want to share how that if many of you use a model like cognitive behavioral therapy, EMDR, this is a very complementary fit where it's not either or, it's both and. One of the things that I came across recently to kind of share with you as to how things are getting a little bit worse for our kids. And I don't need to tell you this, but I think our children's mental health is declining at an alarming rate. Our most recent data from 2021 from the CDC is stunning. 42% of our youth are experiencing persistent feelings of sadness and hopelessness. This is up from 28% in 2011. And this is very serious. 22% are seriously considering suicide, up from 16%. And one of the things that fuels this that we know is anxiety. When I first started, counseling back in the 80s, we didn't see this increase. And I want to share with you some of my theories as to why and support it with some really solid rationale. When there is difficulties, there's also a lot of hope as well. For those of you who are first meeting me, I'm Dr. Scott Sells. I'm the founder of the Family Trauma Institute. For those of you who have been part of the family for a while, just want to shout out and say thank you for looking at our life's work in this area. Um, the Family Trauma Institute, which was created on the heels of the family systems trauma model, was to fill a gap in our mental health uh, continuum where there is so much on trauma treatment for the individual. But when you say, how do we bridge it from the individual to the family or the traumatized family, especially step by step, there's a gap there. So when I sat down, the first book I wrote with the founder of Strategic Family Therapy, Jay Haley, was for real kids with conduct disorders, opposite defiant disorders. The second book, Parenting Your Out of Control Teenager, which is for parents, was written for them. But then what we saw over and over again, I don't know if you see this as well, is if you stabilize the extreme behaviors, there's oftentimes trauma that's fueling it from beneath, that comes to the surface or is there right away. And so this book was written after 10 years of research with my colleague Ellen Souter, treating the traumatized child and its step-by-step family systems approach. I want you to walk away today not only hopeful and energized that you can do family systems work, but that you can, even in an hour, say, I can use these tools the next day. Scott just doesn't give me a lot of theory. He gives me practical step-by-step tools. And so for those of you who want to kind of afterward go to the trauma.com, there's more information for you as well. So from this book, there's 12 core techniques, and we're going to be landing on number 9, feedback loops and undercurrents, how that drives the anxiety from a root level, because parents and children don't want to just pull weeds. They want to get to what's the root cause. And so we're going to pivot then to a trauma playbook. What that means is the carefully customized written plan in the here and now to help both the child or adolescent and the family get unstuck in the area of anxiety. And I'm going to be showing a case example of a very difficult case, Morgan, who's 16 years old, and I'll talk about that in just a second. Next month, I want to just help you save the date on nutrition and trauma. This is an underutilized area in trauma treatment. We often treat trauma from a more of a medicated brain instead of a nutritional brain. And a lot of families don't understand the benefit that the brain can heal with the right food and the increased intake of water. We see more and more kids today just sucking down energy drinks, um, like they're going out of style. So, this is something that we have to bring to the parents' awareness and the child's awareness how trauma and the brain and nutrition all fit together. So, I'm very proud of the fact that the FST model is very holistic. I'm going to ask you at the end if I did my job well as a teacher, facilitator, that like looking at the stars through the Hubble telescope, did you see how FST allows you to think differently about anxiety? If I did that, it's awesome because we have to look at our lens and how we see the world will determine how we treat the problem. So here's my pinky promises. I guess it's kind of funny. I have three objectives today in an hour, and then I'm going to stay after within that hour to answer questions. So if you see something immediately, just put it in the chat bar or the Q&A. Allison will be kind of collecting these comments and questions. So just feel free as they come up to just put your question or comment. And no question is a bad question. So the first one is why treating child anxiety or adolescent anxiety individually without a systems approach can lead to relapse. I want to make a case for that first. And the second thing is, I want to show how parents don't mean to, or caregivers, but they fuel or enable their child's anxiety through over accommodation. And there's a really important study by the Journal of New England Medicine that shows that if you work with the child through things like CBT, cognitive behavioral therapy, but you send that child right back to the same unchanged family, especially with anxiety, you're going to see, and this issue of over accommodation, the relapse rate is huge with anxiety. So it's really got to be both and not either or. And then, of course, I don't want to leave you with just the why, but I want to talk about some of the how of how to stop over accommodation. And this is one of the few webinars where I do an on demand 3 hour CE continuing education. And I'll share with you at the end so that if you really like this and want to do a deep dive on family systems trauma with anxiety, there is a clear pathway for you to do that at a very, very reasonable price to do that or cost. So, Morgan, at the end of today, we're going to kind of pull these tools together so you can actually experientially see them. I'm a big believer that if I'm going to give tools, you need to experientially see them applied. Morgan is 16 years old. I come in as the role of a consultant. She has had sexual abuse, and and as shocking as this may be, she also was sexually abused in the residential treatment program that she just came out of. So mom also, on top of that, has a lupus. So she is wrapped up into lawsuits, and she can't even get out of bed. And then what has happened is Morgan has developed huge social anxiety that's been generalized. Mom over accommodates and becomes like what's called a helicopter parent. Um, to make matters worse, Morgan is going on an app called Tinder and having men come through her window to have sex with her. So this is like such a chaotic system. Mom, like I said, is medically impaired. There's this deeply embedded stronghold of shame. So I really want to show how cognitive behavioral work and systems work can go together like peas and carrots. And clinical depression is following. We see a lot of kids with anxiety also have the co-occurring disorder of depression. So like I said, I'll talk about this at the end, where if you want, you love this or passionate about this approach, there is a 3-hour intensive and a workbook for you to really go to the next level. All right, let's start with number one. Why is this an important thing to think about? Going both individual and family systems, and how can it lead to relapse? So I'm going to propose a both and individual and family work, not either or. The first thing is that the statistics are showing us that more than half of the children who live with an anxious parent end up meeting the criteria for anxiety disorder itself. That shows you that there's a dance between parent and child around anxiety. So if you only take one part of the system and change it, you're putting one hand behind your back, or we have to look at the whole is greater than the sum of the parts. Anxiety is not something that we need to be like, oh, it's not a bad thing. It's a need to respond to uncertainty. But what's happening today, and this has been a real shift, is parents today are more often doing the opposite. They're insulating their child from distress and discomfort when there's no imminent danger. Now, this is important. I was just working with a family, and the child had anxiety one day at the beginning of school about taking the bus. There was no imminent danger, but the mom went into overdrive because she felt the anxiety and she was anxious. And so she started taking the child to school every day and stopping at Starbucks for coffee. So if I'm the child, I'm not going to be able to work through my anxiety because someone is insulating it from me. There's no imminent danger. And the mom didn't even know she was over accommodating. So why change if I don't know that what I'm doing is not helping? So the child was being seen individually, but the it started to develop actually into a phobia of going on contained places. So that's what happens with anxiety. It hangs around long enough and it starts to develop into a phobia. And now you've got real problems because it's now embedded in the psyche of the person. So cognitive behavioral therapy, they did a study, and like I said, in the Journal of New England Medicine, where after 12 weeks of CBT, the children and adolescents that were treated were very much improved or much improved. I'm telling you, if I had a model that had 60% success rate, I would be doing the happy dance. But here's an interesting finding they found in the study, but it wasn't a permanent cure. It wasn't what I call sticky, the stickiness factor. That after the initial positive outcomes were there, it faded over time. Now ask yourself, why would that be? That's an important conclusion. So why? CBT focused on the child's role in the anxiety disorder, but neglected the parent's response to that anxiety. And I underline that, as I lifted this off the journal. And they further found that even when the parent participated in the therapy, it was just kind of giving them a summary of what happened in treatment, but their emphasis always remained on the child, what they were doing, not the parent. And the source from where this article comes from, or the journal is quoted, and you can get this if you Google it, The Anxious Child and the Crisis of Modern Parenting. Google it on May 2020, The Atlantic. You don't have to pay for it, it just comes up. But it's a fascinating article around this issue. So, how do parents fuel and enable child anxiety? The word is over accommodation. That's the word that you would use when you start doing trauma informed education before you do trauma responsive application. So you do psychoeducation first, and then the family or the individual say, now what? What tools are you going to give me in the here and now to stop over accommodation? Well, we're going to talk about both. So we're going to talk about trauma informed first, or psychoeducation, And then we're going to pivot to application or trauma responsive. Families today are needing both and. So, over accommodation, what's the definition? Well, it's when the parent or caregiver changes their behavior, or it can move into their whole lifestyle to help their child avoid or lessen their feelings of anxiety. And again, this is the key. I always say, parents, is there imminent danger? And when there isn't, they have to really look at this. Is this helping their child have anxiety, maintaining the anxiety? So what happens again is what I said earlier, it prevents anxiety coping skills from developing, like the young lady that was not going on the bus to go to school. There's two types. Number one, there's participation over accommodation, and there is modification over accommodation. And this is something that's important to share with your clients of what the difference is. Both are not good, but one is more a little bit worse than the other. So let's go to participation over accommodation. And these are slides that you can give your parents. Sometimes I have the kid present if they're older. Sometimes I don't, on a case by case basis, because kids are like, I want to know what's going on here. That's part of my anxiety, is I don't know why I'm so anxious. So you got to use your clinical judgment. The parent changes their behavior to actively, and they're actively involved helping their child avoid or reduce the anxiety. This is an example where the parent turns off the lights on and off 3 times because the child is compulsive. The parent's saying, I'm actively going to help you maintain the OCD. They don't say it, but it's happening in a dance. The second thing is that the parent, these are just two examples. Parents always order for their children at dinner because the child won't answer the waiter. This is actively helping maintain social anxiety. And it's out of the parents' awareness. I never say to the parents, I say to the parents, don't blame yourself. You didn't have a handbook on this stuff. The point is where do we go from now? We can't change the past, but what are we going to do in the future? And that's something you want to write down, because parents feel so bad when you show this, and you just got to say, look, this is, you didn't have this information. Then I'll say this is when it gets a little bit harder, because it becomes a lifestyle change, where it actually becomes ingrained in the lifestyle. So they change their lifestyle or daily life to walk on eggshells to help the child avoid or reduce. And they get the siblings involved in this too. So they stop inviting guests to the house when the child is home because of social anxiety. So they've changed their whole lifestyle. Even the siblings are like, why can't we invite guests over at the house, my friends? Because your sister or brother can't handle it. And so then we see siblings walk on tippy toes around their brother's room because he doesn't like the noise. Again, the siblings are changing their lifestyle. So it may start as active participation and morph into lifestyle modification. And again, once it becomes lifestyle modification, you need a blowtorch sometimes to get it off the barnacle of the ship, because it gets part of the dance. So the end piece is that childhood anxiety is not only a child problem, it's a child and parent problem. That's the reframe. Parents may not cause the anxiety, but they can fuel it or enable it through over accommodation, through either active participation or lifestyle modification. And so number one is covered, where I this is why I think we need to treat anxiety both and. Let's go to number two. Number two is how exactly this works. Again, these slides are coming to you after the recording, so I want you to feel free to use them. So I will show parents this table, and with Morgan, I did that. So later on in this webinar, I'll show you how this is done. But this is just an example. Separation anxiety, the symptom of that, and again, it's just an example, is the child might be afraid to be alone at night. then the over accommodation that the family makes is that the mom lies with the child every night until the child falls asleep or is allowed to sleep with the parents. It's the child's choice. And this becomes active participation. And if it keeps going, it starts to become a lifestyle. Like 2 years, the child has been sleeping in the parents' room, even when they're 13 years old, they're still sleeping in between the parents. Of course, that's going to have a negative impact on the marital relationship of the spouses. Let's go to number two: social anxiety. The child is afraid to meet with new friends or talk with them. The over accommodation is that the siblings are required to play with their sister anytime she asks, and you got to cancel your plans. This becomes over time a lifestyle change because this is like the new normal. Um, and it's happened for years and years and years. And of course, the implications of that are the siblings are going to be resentful to the person in their family that's having this. So it unleashes a lot of other problems. So another one is generalized anxiety. The child is constantly worried that the parents are going to die at work. The parents both text their child even when they're at work every hour while they're at work, even if the husband or wife is at risk of losing their job because it's a board meeting and they can't keep going out of the meeting, they'll do it. And so it's active participation. And then obsessive compulsive disorder. The child is afraid not to, they're afraid they're not clean enough after pooping and keeps using the toilet paper. And the parent buys $150 in toilet paper, and the plumber has to constantly unclean the pipes. And this becomes active participation. So you're starting to see, hopefully, as you're watching this on demand or live, that there's a definite connection or a dance between the anxiety where it may not have been caused by the parents, but they're fueling it with gasoline on a fire. That's why if you just work with the child and don't change this over accommodation dance, there's like a tractor being pulled towards the anxiety continuing to resurface as well. So one of the things that I do in FST and what I'm going to, if you do the 3 hour intensive, you'll see is that you've got to translate this table into showing the family a dance because they'll be like, well, I see it linearly, but how do I see it in a dance move? Well, we call these feedback loops. So with Morgan's case, this is what I showed them, as I said that with mom and her boyfriend, Chris, there was a symptom of social anxiety with aggression. So I would say that there was a wound here that's going on with this anxiety. And I would say to them, mom and Morgan and Chris is kind of outside looking in. And I would say that the first dance move, and I'll say to the family, I don't even know if I have this totally right. So I humbly submit this to you because you can change the words. I'm just saying this is my gut feel of what is going on around social anxiety. And I'll say what I think is happening is, Mom, you might start the dance off, or Morgan, you start off by saying, Mom, I can't have people over. It freaks me out. And then, Mom, your next dance move, and I'll actually do this with my finger, is I'll say that you say, okay, just calm down. I want to have my friends over. I mean, I haven't had my friends over for a long time. Chill out, Morgan. And Morgan, then you dance and say, look, fight or flight. I'm telling you, no means no. And you start to get your voice goes up, you start to shout, and mom's like starting to go, oh no, she's going to get aggressive. And then your next dance move is, all right, all right, all right, all right. No friends over. Just stop losing it. And she thinks to herself cognitively, I got to soothe my daughter. I got to calm her down. I can't leave her alone. And so all of a sudden, this wound starts to come where mom starts to get resentful because this has been going on for a long time. And then the next dance move is that Chris is like, gosh, I gotta be the peacemaker again. I don't think I can take it. So what you want to do, and I'm going to show you how to do this, is that you have to give the family a RX prescription, an antibiotic, amoxicillin, because they'll be saying, this is pretty accurate. or they might change the words, and then they'll say, well, now what? You can't just say, well, now that you know what to do, just try it at home and we hope for the best. They need a prescription, just like if you went to a medical doctor and said, okay, here's the blood work, here's the x-ray, here's the feedback loop. We really don't have any prescription to help you through this cancer, but at least you know it exists. The patient's going to be like, what? So that's what happens in mental health and why parents get so anxious, because they're like, I like the psychoeducation or the trauma informed, but I need trauma responsive. Where's the application? So, current anxiety treatment, I think right now, is not including the active participation of these members of the family to change the over accommodation dance. And it is because a lot of mental health professionals didn't even know this, just like parents. And so, a key point is that parents are going to sacrifice short term anxiety pain relief, but long-term coping skills never happen. So they may stop the anxiety in their child, but it doesn't leave room for any coping skills. So they're not going to wake up one day by osmosis and say, gee, I'm over accommodating. What do I do? They'll just keep going. And the definition of insanity is doing the same thing over and over again. So now the question is, okay, what do we do about it? How many of you, by a show of hands, see right now that I've presented a good argument for connection of anxiety as a systems problem? How many of you, by a show of hands? Okay, we got a lot of people. All right, I'm doing good so far. Thank you. Um, and put in your chat bar if you really like enjoyed this part so far. So now the question becomes, what do we do about it? So this is where I'm going to pivot to a case study to connect the dots. Okay. And I thank you, Marianne, Alina. Okay. Yay. Okay. I'm glad. I love doing this stuff, as you can tell, because it's like as I get to help you guys become experts at this, it's only going to help our families. So thank you for that. All right, so now let's go to the next point, which is, okay, where are the tools to stop the, over accommodation dance? And so I'm going to give you an overview, and if you want to do the deep dive, there's the on-demand intensive that I'll talk about at the very end. So because of time, I'm going to kind of surface this, okay? So undercurrents, FST undercurrents, FST feedback loops, FST strongholds, and FST playbooks. Okay. These are the tools in your tool belt. Okay. All right. So for those of you who want to do some learning on your own, if you go to the book, Treating the Traumatized Child, in chapter 7, there is what I'm going to pull out of the book is called The Wound Story with Self-Regulation Tools. And there is a table, and I'm going to talk about shame. I'm not going to have time to talk about performance, blame, or approval, but these are lies that people believe that are at the heart of driving the over accommodation dance. So you got to keep going for deep tissue work here. Like if you're going for a massage and you've got this knot that's way deep in your back, and the massage therapist knows exactly where to tap, all of a sudden the pain is released and there's hope. So this is a really important integration of CBT and family systems trauma on steroids. Okay. So let's talk about this. So we're going to integrate CBT strongholds, rocket fuel, with family systems trauma, how they dance together. Okay. So there's two main causes of this over accommodation dance. First, there's the mind. Okay. What we think. Where the mind goes, the person follows. Where the mind goes, the person follows. And there is an interactional dance with the body. So the mind and body are working together to fuel the anxiety, but it's also where the solution is. So a lot of times therapists will say, okay, I'm just going to deal with the mind without the body, or I'm going to deal with the body without the mind. Well, there's a connection between the head and the heart. So we've got, if we're going to really increase the odds that we're going to really get to more permanent change, I think we need to attack or tackle both and. So one of the things I do is people are very into metaphors and pictures. And so one of the things that I try to do is a Michael White technique called externalizing the problem. What this means is that many people that come into your office are going to start pointing fingers at each other and blame and shame each other. Like, how many times have you heard this one? Just fix my kid. If you've heard that one a lot, put yes in your chat bar. We've got to move them off of that narrative to say the real enemy is, in this case, a spider. Now, spiders like to be hanging out in the dark and they cast out webs. Um, and so, what we've got to shift our view is instead of blaming Morgan, that's what I told Mom and Chris, let's kill the spider. And this is what's called the stronghold. This is a lie about what we believe about ourselves. It's not true, but it affects our day to day life. It doesn't matter if it's true or not. If we believe it, it's going to affect our life. So we've got to figure out together to kill it. Now, do you see how I'm externalizing the problem? I'm lifting it away from Morgan and putting it on the spider. And everybody and Morgan and the family like this metaphor. And then I said, together, let's locate Morgan's stronghold. And we call it a spider of shame. It could be a spider of approval addiction, a spider of blame. But right now, I kind of knew that this was going to be shame, especially around the sexual abuse. So in the book, I'm going to lift this off here. The table is that I show the family this here. And I say, let's start with the web of the spider, which is the symptoms, and let's work our way into the spider. I say, Morgan, do you have a worried, anxious mind? Yes, she says. Do you have a sense of unworthiness? Yes. Do you have depression? Yes. Do I have hopelessness? Yes. Do you self-sabotage yourself? Do you despise she listed yes. And then mom says, I've got all these too. So what's going to happen just spontaneously is other members of the family are going to join in and say, I have this too. And Morgan's thinking to herself, great, I'm not alone. I said, Morgan, do you feel these beliefs? I am damaged. I am never good enough. I am worthless. I cannot change. I do not deserve to be loved. She says, I have all these. Mom says she has all these too. And I say, this is what we've got to take out of commission, shame. Morgan said, this gives me relief just to know I have a word for it. I've been so anxious going over, rattling in my mind. I can't sleep all night. What is wrong with me? And I'll say, let's go experiential. I'll then take a pen or an arrow from the outdoor store, and I'll break off the tip of the arrow for safety reasons. And I'll say that what happens with shame is that when the abuse occurred, sexual abuse, it started to create generalized anxiety disorder because it started taking out your heart. So I'll say these arrows to your heart have prevented healing. And the original wound is the sexual abuse. So I'll do it for myself first. Like, I won't have Morgan do it, but then a lot of times Morgan wants to do it. So I'll say, do you want to put the arrows in as I'm doing it? And then I offer her a pen. And many of the clients I work with do want to do this. And then I'll say, do you see how when the abuse happened, an arrow comes to your heart that's charged with emotions where it's like, I am what I am, I cannot change, I am not good enough, I am damaged. I do not deserve to be loved. And this was where Morgan started to really cry, and so did mom, because they said the arrows are still lodged in your heart. And what happens is that they actually help you. They take you see the world like this through these arrows instead of removing where you can see clearly. So I said, our job as a family is to remove these heart arrows from Morgan, like King Arthur removed the sword from the stone. Because when your heart is taken out, not a good thing. So when you're getting this kind of work done, experiential is really, really important. So then I say to Jennifer, that's the mom, she moves closer to Morgan, and Chris is watching this too. They're ready for the handout. So I said, so what happens after the arrows come into the heart? Remember, I'm doing high level psychoeducation right now, or trauma informed. Is I say, Mom, uh, you have anxiety around separation. You can't, you're like, you, you hover around Morgan. Um, and you're afraid to let Morgan out of your sight. You have a worried, anxious mind. And she distracts you from, Morgan, you distract your mom from her own pain by daily fighting. Like your mom has lupus. So, in some ways, unconsciously, you're helping your mom because while your mom's focused on you so much, um, she's not worried about her lupus as much. So it's going into a dance. And I'll say that it's become a lifestyle. So this has to be untangled. And they're shaking their heads like, wow, you're making these connect the dots. No blame, no shame. I say, this is just important stuff first. Then I'll say, Morgan, you have generalized anxiety. And I'll say, you're afraid to go out and meet new people. Uh, it brings about depression and hopelessness. And your mom won't leave the house. And you're feeling like it's like, oh my gosh, I'm feeling like I can't breathe anymore. And so then you guys argue all the time, and this again is a lifestyle. So now they're primed for now what? So then I start to move in FST into CBT. And then I'll say, okay, let's go to undercurrents because we talked about the mind. Now let's go to the interactional dance because the mind goes, the person follows. So then I bring up in the model a apple tree, and I'll put all the symptoms or stressors, they call them, on the apples. I'll say, if I was an apple tree doctor, I could see with my naked eye aggression if I was at your house. I could see anxiety. I could see depression. I could see disrespect. But we've got to be like Sherlock Holmes, and together we've got to go underneath the soil of what's unseen to the naked eye, because these are the drivers that are causing the fruit to be bruised and not heal. Because if you keep picking the fruit off, but you don't get to the root, what's going to happen to the fruit? It's going to just grow back as bruised as before. So I say to them, one of the things I think is going on, and they're part of this discussion, is I think that the arrows and the sexual abuse has caused your family to go off its access point. There's mental or physical impairment. So what I'll give them, and this will be provided in the intensive 3 hour, is a handout where I'll say that I think what's happening now, and I always hold it loosely, and they are like, we're collaboratively like scientists figuring this out. I'll say that the illness and the anxiety has been drawn out, and that's a root. And what we've got to do is I have to help you as a coach for education, support, and stress management. I also think the risk has been for you, Morgan, that you've been seen as a patient or mental case, or what we call learned helplessness. I'm not blaming anyone, but you've lost your confidence, Morgan. And mom is walking on eggshells. I have to help you see that you're not a mental patient. You're normal, but you're stuck in a rut. And then I asked them if there was a chemical imbalance. They said no. I said, is there a mental or brain impairment? They said no. Is there a lack of forgiveness and resentment? They said yes, but I said, well, let's focus on the top two. And they're also, the nurturance is taking a hit. But I said, because of our gallon of gas, we're going to focus on the top two. Then what I do is I summarize it in a table so they can zero in on it. And I say, I'm going to do a feedback loop where I'm going to show you this over accommodation dance, where I'm going to show you that what you're dancing around a drawn out medical illness or seen as a patient is the undercurrents that is causing the mental or physical impairment seed to go toxic. And it's causing the symptoms or the fruit of the apple tree not to heal. So they're interested in getting to the root. And then I'm going to say to them, I'm going to also show you the after feedback loop of what it would be like in the future for support and stress management and normality. So I draw this out for them. And I'll say, look at this seed. It's fat and happy because it's getting a daily dose of unhealthy undercurrents. And I'll say, here's the dance. Morgan, mom, you started off, all I think about is where I fell short as a mom. I'm racked with guilt. The next dance move. I know I should be over this pain, Morgan says, but I'm frozen. And why do I keep picking the wrong guy? Next, and then the stronghold starts to kick in, and I'll actually do the arrow to the heart. And I'll say, I do not deserve to be loved. So you're integrating CBT and feedback loops together, thoughts and actions. And then the next dance move, I have to get more out of my own life, but I have to watch her like a hawk. And my mom is just so focused on me. I'm ready to burst. Won't you trust me? And the next dance move is here comes the disrespect or the argument. I'm losing my baby emotionally. I don't know what to do, but if I push, the more I push, the more distance she gets. And Morgan likes to eat a lot of Big Macs, so I put that in. I'm medicating my pain with food or Big Macs. And Chris is like, I don't think I can take it. So the undercurrents here is being seen as a fragile patient, drawn out problem, no resolution in sight, and no normality, and there's no healthy anxiety coping skills. If you show your family this, you're going to get their attention. Will it be clumsy at first? Yeah. Will you maybe be off track? They'll correct you, but they've got to see it before they're willing to say, you know, okay, I'm bought in because you're giving me what's the higher calling, what's the sacred journey. I now know what's in it for me because you're mapping out the dance. It's like going to a doctor when I have a real problem. Thank you for mapping out on an x-ray what the problem is. Now I'm bought in for the solution. So then what you're going to see now in the video clip as we end the last 15 minutes is what happens next. In FST, I'm a big believer that we have to give people written plans. Early in my career, my plans were all verbal. I had no dress rehearsals or practice with the delivery. And it seemed like 75% of the time the family would come back and said it didn't work. And I realized through careful research that I was setting them up for failure because one, I didn't give them a rationale as to why they should do the intervention, like with feedback loops, with good psychoeducation. I just went ahead and said, well, your kid's disrespectful, just take away their phone. Here with anxiety, you've got to get them bought into what's in it for them. So here's where the shifts really starts to happen. You go from trauma informed to trauma responsive. Let's watch. So after the feedback loop happens, okay, then I go, okay, let's go to let's connect the dots to the higher calling of support and stress management and normality. And I'm going to hand you what's called a playbook. And you can also use the analogy that this is an antibiotic or a Z-Pack if you had strep throat. So I'll say, here's what it looks like. I'll say there's a who clearly spelled out, a what, a when, and a where. And I'll say to them, this is just a sample. When we meet again, we'll flesh it out. But I just want to show you what it could look like. And I'm just giving you the basic template. Who, what, when, where, and what's left off is how. So I'll show you that in a second. So again, I go back to my book, Treating the Traumatized Child, and I go to chapter 8, and it's like a Top Chef cookbook where I'm looking for a recipe or an intervention that's going to be around, drawn out medical illness. Here's techniques on the right side: stress management, creative outlet, someone seen as a mental patient. So it gives me an idea as a cook in the kitchen, what kind of interventions am I going to use for that undercurrent? So here, what I pick out is a support plan and a volunteer work. I call mom on the phone and I said, what is Morgan's love language? And I give her you can go on the love language website and there's actually a quiz that the parent can take. And she says it's really, helping others. It's really, caring for other people. And I'll say, well, what is she really passionate about? She likes to work with seniors. I'm like, okay, so then the light bulb's going on. And I'm a chef in the kitchen before they come in. So I say, okay, so I have an RX prescription I'm developing to inject the missing healthy undercurrents like a blood transfusion to change the anxiety dance. So I know that I have to do support and volunteer. I know where to tap. So then I go in and I start with a preamble. I said, Morgan, people have hurt you mentally or physically, and they've tried to put arrows in your heart permanently. And this has cast you with a stronghold where you feel I'm alone, I'm damaged. But the seniors probably have the same strongholds of shame. By you having the courage to pull out their arrows, your arrows will come out as well. So I found local senior centers around Morgan. And if I'm working with a case manager, the case manager does a lot of this work with me, like Batman and Robin. I didn't have a case manager at the time, so I had to do both case management and treatment. But the who was that I said, Morgan. So I called the coordinator of the volunteer coordinator at the nursing home, Rochelle, and I said, Rochelle, do you think it's even possible for Morgan to, volunteer? She said, sure. So I said the seniors have and then the what is a list of the intervention, which is volunteer at least 1 week. And what was amazing is that at this nursing home, they had, and I don't make this stuff up, adopt a heart for one of the seniors. And we were just talking about arrows to the heart. So that's really beautiful how it all works out that way. So then I say, these are to be determined. This is a sample. If you like this intervention, when we meet next week, we'll fill out the what, when, the where, and the how. These are just examples to get us started. So I'm a social worker at heart, and I'm a big believer that you try to bring the cars to couple together like the caboose with the main car. And so I say to Rochelle, you know, would it be possible if I put you on speakerphone, and would you invite Morgan to, come for an interview? And Morgan and Rochelle says, sure. So I show them this feedback loop and I'll say, what if we use this antibiotic of helping others? Morgan, you're much happier. I know this is in the future, and I know it's like a movie trailer of upcoming attractions, but this could happen. You feel happier. The next dance move is I don't have the time for the pain. I love helping others. Guys can wait. I have my own volunteer job. Mom starts to volunteer too. She has a better relationship with Chris. Mom is more relaxed and less tense. And we have house rules around trust. The shame arrows start to come out. I don't need Big Macs. Guys can wait. Chris is like, this is really great. And they might say, this is too easy. This won't work. And I'll say, it might not. But what do we have to lose to experiment? Because it's like, I'm showing you the Grand Canyon, but let's go down on the donkeys to the bottom of the Grand Canyon. So as long as it's connected to the higher calling, people are more likely to try this. Okay. So watch in this video clip the shift that happens where mom has the playbook. I'm facilitating this with Rochelle. Watch Morgan's legs stop shaking because the body keeps the score. And watch how one little antibiotic can throw a big pebble in the pond and watch it ripple out. I believe families will do well if they can, but they need clear tools to do so. Let's watch. The undercurrent that I'm going to attack here in a good way is I'm going to replace these two, or not me, but Jennifer and all of us together are going to put a stake in the ground and say, we are no longer going to let these two things hang around like a bad cold. We're going to replace them with support and stress management and normality. Morgan, people who have hurt you mentally or physically have tried to put arrows in your heart permanently and cast you with shame and making you feel at times, I am all alone, I am damaged, I do not deserve to be loved. By you having the courage and sacrifice to help pull out their arrows, your arrows will come out as well. So who would be involved with this? It would be Morgan, Rochelle, and the seniors. I only had like 15 minutes to call these two places. And Rochelle happened to be at her phone, and she was like, if you let me, I'd like to be on the phone today by speakerphone when you're meeting with Morgan, because I have a daughter who's going through stuff, and we have seniors that need someone like Morgan. And I would like to take her under my wing. And you know how you meet people you don't even know, but Write in your chat bar your theory of why is mom just weeping right now. Stick a pin in that because I'm going to come back to that. Why is mom weeping right now? Look at Morgan's leg has stopped shaking because if you do the 3-hour intensive CE, you'll see the whole case unfold. And in earlier video clips, you'll see her leg going like this. And you see the smile in the face of Morgan. This is hope. And look at Chris putting his arm on Jennifer's leg. Isn't it amazing how systems theory works? It's really fun to watch. Let's watch. In there, and it was just like, wow. So what I'd like to do is call her, and she just wants to introduce herself. She wants to say, that it's still up to you if you want to, but she wanted me to call her, and she's waiting by the phone on a Saturday. She's off, but she gave me her cell phone. And so, remember you said lack of support village? So I guess we were on the same page with that. So let me call her, and she wants to say hi. I know it's not a Big Mac, but anyways, let's go ahead and call her.
So what is it? Thank you.
Hi, Rochelle. This is Dr. Sells. How are you?
I'm good. How are you?
All right, good. Well, I have Morgan and her family here, and they are smiling from ear to ear because I told them about our call and how it was such a miracle that you happened to be at your desk right before the meeting. And, and so I guess I'm wondering if you could tell Morgan a little bit about, how much you could really use her help and how excited you would be to work with her. And then she might have some questions, and so may Mom, and so may Chris. Okay, good.
Yeah, absolutely. Well, I work at the senior living, assisted living center, and we would start out with just plugging you in where you feel comfortable. I have office work, or if you feel comfortable one-on-one, or we would just sit down and we would see what you feel comfortable with, and then yeah.
And Morgan, would you say hi?
Hello.
Hi, Morgan.
Thank you.
Is this something that might interest you?
Yes, of course.
So as we wrap things up, and I'll stay a little bit longer for question and answer. I have nowhere to go today, but if you have to leave at the top of the hour, no worries, and this will be recorded so you can see the answer and question and answer at the end if you want to. But what I wanted to summarize here is we have the trauma, the sexual abuse, the social anxiety. The playbook gets Morgan out of the house to work with seniors. The shame arrow is attacked through the volunteer playbook. She gets more confidence, and she starts to not feel so much as a patient when she's helping others. And also what happens is Mom doesn't have to continue to do a lifestyle over accommodation. The cognitive stronghold of shame is weakened. One small change at a time interrupts a flight or flight dance. So I hope today that I did my job where you felt like I hit all three of these takeaways, and that I don't know by show of hands if you are thinking differently about anxiety through a family systems trauma lens. And like I said, if you want to go deeper, it's pretty easy. It's you just write this down, and Allison will put it in the chat bar. It's fstanxiety.com. Uh, when you do that, go to a landing page, and I actually have two other intensives on disrespect and healing suicide. So some people may want to do them all, but you focus on the anxiety. And then I brought the price down to $99 because I want as many people as they can to do this. So, and the workbook that you'll get will have all these handouts in it. It'll have the over accommodation, the flow chart, the stress chart. So when you register, we'll send you the workbook so that you can watch the intensive and have the workbook. And a lot of agencies have done this, and they've gotten together with their staff on this as well. So if any of you are from agencies out there and want me to come and work with the whole agency on this kind of stuff, please keep me in mind for that. And just email us directly at info@familytrauma.com. I'm doing so much more of that where I get the ability to train entire agencies on family systems trauma. So I'm really enjoying that shift these days. So as we wrap up today, Allison, what were some of the questions that people had or comments as we did the webinar today?
Okay, so I did want to let everyone know that you will receive a copy, a link to the recording. It will come tomorrow. Dr. Sells, I believe you said that they would get a copy of the slides as well. So don't forget to send me those right after this webinar. And so, yes, someone else asked what the title of the book is that you referred to. So is that Treating the Traumatized Child, a Step-by-Step Family Systems Approach?
Yep. And I can just put it up while we're talking, but I'll bring that up so people can see.
Okay.
Yeah.
All right. So that is the book. Okay. We have one question here. If you have other questions, go ahead and put them into the chat. I'm sorry, put them into the Q&A, please. Okay. So Christy asked, for the first example you gave with the child who is anxious at night, Do you
Mhm.
have any tools and recommendations for how to help the family fix the sleep situation? I have a client exactly like this, and so far the anxiety has improved overall, but the lack of productive sleep for all keeps fueling and refueling the anxiety loop. Child is almost 13, and this has been going on their whole life in some way, shape, or form.
Yeah, you would replicate the process you saw today. You would, talk about the term over accommodation. Then you would move to your a customized table to show, the problem, the symptom, the over accommodation, and it's very you hold it loose in your hand and you say, "This is what I think's happening," and then you would translate that into a feedback loop, like you saw, and then you would, come up with an intervention around the undercurrent. So if that is something that you're interested in, the definitely the intensive will help make even more of those connect the dots. So I tell people we talked about Morgan and social anxiety, but you replicate the process whichever the problem is, and in this case, what you just described earlier about the daughter. So repeat the process with the particular problem. Next question.
Okay. Do we need a certificate or degree in counseling to learn and implement these strategies? Do you have a database of certified people who can help families?
Yeah, familytrauma.com. People who have taken the more intensive course go on for certification, and there's a list of people that are qualified at a counselor level. But don't sell yourself short in the role of, if let's say you're a parent support advocate, you could take the part of the webinar today of talking about over accommodation. Just the fact that you're connecting those dots in a psychoeducation format is huge. You can say, I'm not maybe qualified to take it from here, but I'm here to pass the baton to counselors that know how to do family work as well. So I always say everybody plays a part in the healing of our families with anxiety. So thanks for that question, by the way. Any other questions or comments?
Yes. What do you do when the parent appears to be, this is our last question, by the way. I know folks have to go. What do you do when the parent appears to be the only one with anxiety and the kids are feeding off of that parent's anxiety?
That's an interesting, you can use what I call kind of a paradoxical intervention where once you make it known the dance with the feedback loop, sometimes temporarily we can have the kids take care of the mother. We don't want to do it for long because we don't want to risk a child being parentified, but we have to get the system unstuck because it's in neutral. So as an example, I might have the kids on a temporary level over accommodate for the mom, and the mom will often say something wakes up in her maternal instincts and says, "No, I can't let you do this. And I'm going to start doing what I got to do to lower my anxiety." So you upside down the hierarchy. And sometimes it really works because you kind of go with the family's resistance and you make it more amplified. So with those, I really do a lot of consultation because if you haven't done them before, you got to know what you're doing. But those are more difficult cases. And that's why I do the intensive training and the certification that you can see on the website if you're interested on that level. So that was a great question, by the way. Is that it? I love taking questions, but I also want to respect people's time.
Yep, that was the last question.
Okay, so I'll just finish up by saying thank you for those of you watching on demand, those of you who are live. I just appreciate what you all are doing because the time is now for us to do both and I know for a lot of you, family systems is not maybe something you got in graduate school. It may be a little scary, but I hope that you are now part of the family, and I'll do everything I can to get your confidence up so you can go in here, because if you don't do it, who will? So thank you for all the comments on the side as well. I hope you have a great week, everybody. Take care. Bye now.